Hello, welcome to lesson 6.6 of the ALS refresher. This is going to examine a special patient population, the LGBT plus community. In this 2 year iteration of the refresher, because we change the content every 2 years, this is one of the two special patient populations that we are looking at. The first being the autism spectrum disorder community, and the second being the LGBT plus community. This is a community that not only MIFRE chose to highlight in its special patients population piece of the refresher, because we have some flexibility with the NCCR guidelines, but also MIMS has chosen to highlight that community as well. So when you go on to do your ICCR component, or excuse me, your LCCR component, your local/state component on the MIMS website, and you do the required ALS classes that you're required by MIMS to do. One of those classes is going to focus on the transgender community. It's a topic that the state ALS committee that MIMS has decided is important to go over, and we're going to kind of look at why that is. So in this lesson, we're going to look at the meaning of all of the different terms that you see. Some people get really confused like this, or they call it the alphabet, the LGBTQIA plus community, and just what that actually means. So we're going to look at that. We're going to summarize some of the unique challenges that these individuals face related to healthcare. And then, really, the focus of this lesson is going to dive into their special healthcare needs and how we can provide inclusive patient care practices. So, we'll start by looking at some statistics specific to the state of Maryland. We'll then dive quickly into what the actual meanings of these different terms are. We'll look at some of the health care challenges that are faced. And then the meat of this presentation is spent is looking at the healthcare concerns for each of these groups. Because I think that one of the things that you're going to see as a part of this presentation is that there are specialized health care needs for these individual groups that you probably didn't realize, some medications that it's important to know, and things like that. And so finally, we'll end with how we create inclusive patient care and spaces. So why are we doing this? There's a lot of different things that we could give here, but it's important to start with a story that actually is a story that hits close to home. So this is a story that comes out of Washington, D.C. in the late 1990s. So Tyra Hunter was a transgender female person who was seriously injured in a motor vehicle crash in Washington, D.C. According to the testimony from witnesses, when paramedics removed her clothing at the scene of the accident and were surprised to find her male genitals, they actually refused to care for her, making crude jokes. This unprofessional behavior actually continued in the ED, which I think is one of the most surprising parts of this case, leading to delays in care. Hours later, Tyra ended up dying of her injuries. Her medical report predicted that she would have had an 86% chance of surviving the crash with proper care. A jury later awarded her family millions of dollars in damages from the fire department and the hospital. And I can tell you both the clinicians that were involved on the fire department side, as well as the clinicians in the ED that were directly involved in her care, all ended up losing their licenses. Um, you know, I think that society has changed dramatically since the 1990s. However, unfortunately, there are still incidents like this that we see, although not as common. Um, and of course, I think one of the important things to understand, especially when we talk about patients, and especially as we dive into this PowerPoint, it's not that the way that we care for someone who identifies as LGBT plus or any other difference or part of who someone is different. Okay, I think all of us know as ALS clinicians that we see everybody. We don't get to choose the patients that we get to see. Some people we see all the time for the same complaints at 3 o'clock in the morning. I know we've all been there. I myself, as an ALS clinician, have been there. Um, we see people on their worst days. Okay, and I think that the vast majority, 99.9% of clinicians that I've ever had the privilege of working with or knowing and teaching in classes would agree that, at the end of the day, to us, what differences people have or people's lives and their own diversity doesn't really matter to us as much as providing excellent care does. And so that's what we have to remember most importantly as we dive into this presentation. It's not necessarily about changing your own ideas or your own experience, etc. It's that here are some things that are going to provide us some additional cultural awareness, but at the end of the day, it's really not going to change our care. There are some things that we'll highlight in this presentation that are probably going to be new pieces of information that you didn't know specific to the healthcare needs of this community. But a lot of this is also just a cultural competency piece, which is actually required. A cultural competency is required as a part of the NCCR. So that's why we start with this. The purpose of the presentation is not to be political, absolutely at all. It is not to um, you know change your thought processes or your own experiences, beliefs, etc. It's simply to provide you with a background on what some of these things in terms mean to make you a more informed clinician, and how can we take the special healthcare needs that we have for this community and treat these folks even better when it comes to their health than we already do. So the NAMT Codes of Ethics pledges to encourage the quality and equal availability of emergency medical care, and it requires service with compassion and respect for human dignity, while not judging the merits of a patient's request for service. And I think that really just hits home exactly what I was just talking about. So let's look at some statistics when we look at our own state, Maryland specifically. So when we look at adults in Maryland who identify as LGBTQ, 4.2% of adults, or 234,000 people in the state of Maryland, identify as LGBTQ. They make up 5% of the workforce, and adults who are 25 years or older who are LGBT are raising, or 20% of them are raising children. Maryland is a state that has one of the larger populations of LGBT people, and I think that you will continue to see that number increase over time. I think this graph is especially telling and even more important in understanding why we're having this presentation today. So what this graph shows you is Americans who identify as LGBT by generation. And this survey was taken, it was a national survey that was done in 2021. I think what's most telling here is Generation Z, which are our folks who were born between 1997 and 2002. They are the folks that are currently in high school and college. 15.9%, almost 16% of them identify as LGBT. Okay. When we look at millennials, those born between 1980 and 1999, 9% of them identify as LGBT. One of the things that I like to say during this presentation is I don't think that it is that there are more folks in our society who are LGBT today than there were 50 years ago. I think it's because society has drastically changed, and so many people feel much more safer coming out and expressing who it is that they are. And so that's especially true in our younger generations. Okay. And so they are going to be less likely to be closeted. And I think that you're going to continue to see this number rise some with progressive generations. I before I switched to take this career that I'm currently in with the ALS division at MIFRE, I taught high school for the last 15 years, basically from the early 2000s right up through the COVID-19 pandemic. I left teaching in 2021, early 2021. And so I can tell you, as a high school educator, in that time, it drastically changed. And I taught in a very rural part of the state of Maryland. And even during that time, there were many of my students who were publicly LGBT, especially students who identified as transgender. I taught high school, and it was the norm. It wasn't a big deal. Were there still issues occasionally? Of course. Okay, kids are unfortunately kids, um, but kids are much more comfortable today than they were years ago. And one of the things that I say when I give this presentation is that, if I was giving this presentation to kids today, it would not be an awkward topic. Whereas maybe while you're sitting this is an awkward topic to you. Maybe it's not something you feel comfortable with. It's not something you have a lot of background in. Kids don't see it the same way because it's literally part of their everyday lives, because they all have a phone in their pocket that they're connected to the entire world through. It's LGBT folks are represented in media and in movies and television shows now. It's literally not a big deal to them. It's a part of life. The only other thing that I like to point out here is Generation X, those born between 1965 and 1979. So I always say that number is probably less, or percentage I should say, is less than actually what it probably should be. I actually think that you would see that a little bit closer to the millennials if we hadn't had a major epidemic in the 1980s and 1990s. HIV/AIDS. Many of that generation were killed as a result of the HIV/AIDS virus, and so that generation is much smaller. Okay, so then let's take a look at some terms to know as we dive into this presentation. Now, I think it's important to highlight here, these are not terms that MIFRE or MIMS have come up with. These are specific terms that have been adopted by the National Association of EMS Physicians. NAEMT has also utilized these terms. So it's not something that, we just said, this is the definition we're going to use. It is an authoritative source when it comes to EMS. So the first term to understand is sex. So sex is the physical characteristics and biology of a person. When you are born, you are assigned the sex of either male or female at birth, and that is based upon your physical characteristics, your genitalia, and your biology. Gender is one's internally deeply held sense of who they are. Gender identity is a sense of who one is, and gender expression is how we demonstrate that identity to the outside world. So, a lot of people, and you can be free to have your own opinion. We're going to use the definitions that NAAMSP uses, but a lot of people see sex and gender as synonymous. Okay, however, that's not necessarily, or I should say, that's not the case when we use the definition of from NAEMSP and from NAEMT. Okay, they are two separate things. Okay, gender is basically how you see your identity towards the world. Okay, it's not physical, it's not biological. Okay, do you see yourself masculine? Do you see yourself feminine? Do you see yourself as some blend of the two? And we'll talk more about this as we go. Someone who is cisgender, or sometimes you will just hear it as cis, okay? I guarantee you a lot of young people realize this. Maybe you never have heard this term before. This is when the alignment of gender identity and biological sex occurs. So, for example, a man born with the sex of male at birth, he has physical characteristics and biology of a male, and whose gender identity is male is known as a cisgender male. Okay, I identify as a cisgender male. I was born and assigned the sex male at birth. My gender identity is that of a male, so I am cisgender. The opposite of cisgender would be someone who is transgender. So someone who is born with a assigned sex at birth, but gender identity is different than that assigned sex at birth. So, for example, transgender person would be a person who is born and assigned the sex of female at birth, however, whose gender identity is masculine. Okay, and so that would be a transgender male. Okay, because they were born with the sex of female, but their gender is that of being masculine. And we'll explore that a little bit more here in just a bit. Someone who is non-binary or gender queer. Okay, this is just an umbrella term for gender identities that are neither male nor female. Now, I think it's really important when I go over this to explain some cultural misnomers and myths that are out there, some urban myths. I often see on social media, things that are shared, because we know social media is obviously, such a great source of information. Things that are really blatantly wrong, that people think that there are hundreds or thousands of genders, that you can identify as, you know, some gender of some inanimate object. Okay, that is really false. Okay, for 99.9% of people who consider themselves non-binary or genderqueer, they do not think that they can identify as whatever. Okay. um, what really is this means when someone says they are non-binary or someone says that they're genderqueer? All they are saying is, I don't predominantly feel 100% masculine or 100% feminine. I see myself as a blend of the two. I see myself as a blend of masculine features and parts of my personality, and feminine features and parts of my personality. Okay. So I choose not to have a gender identity of male or female. I choose to have a gender identity of non binary, because what these people are saying is that they don't see themselves as 100% masculine or feminine. They see it as a blending of the two. Okay. So that's what it means when someone's non binary genderqueer. Finally, sexuality. This is basically the inherent, enduring emotional, romantic, or sexual attraction to other people. Okay, so then let's get into these terms here briefly before we jump into some of the specialized healthcare needs, because you have to understand the terms before you can do that. So I really like this graphic because it helps to understand the umbrella here. Okay, the terms gay and queer are umbrella terms. Okay, and it basically is an umbrella term, either gay or queer, for individuals who don't identify as straight and or cisgender. Straight would refer to their sexuality, cisgender would refer to their gender identity. Okay, basically, gay or queer are umbrella terms. Okay, for all of these different people under the umbrella, LGBT persons. Okay, now a lot of times when I'm giving this lecture, people will ask me, well, we thought that queer was a bad term because we were taught when kids, like, you should never say that, etc. You're not necessarily wrong. Okay, queer is a term that the LGBT community has kind of taken and spun on its head over the last 50 years. Queer, certainly, especially in the 20th century, was often seen as a derogatory term, very similar very similar to, like, the F word, as it refers to queer people. And so basically, what has happened is that queer people have snatched back this term and used it as a term of pride. Okay, so they've taken a term that was often seen as negative, and now use this as a term to describe who they are. Okay, queer. Now, I will tell you that that is not the same for the F word as it refers to LGBT people. That is still considered an incredibly derogatory term, and I will say that to a certain extent, although not as big of an extent as, like, the F word, homosexual is very similar. LGBT folks really do not like to be called homosexual. Some may correct you, others may not, and that really comes from the fact that up until the late 1970s, the American Psychological Association considered homosexuality as a mental illness. It's since been removed from the DSM, but homosexuality is often considered a term that we really is just not appropriate anymore. Okay, so a lesbian is a woman who is attracted to other women. Okay. Now, while many women will use the term lesbian, okay, some will also just say, I'm gay. Okay. Now, are they going to get mad if you would say, if you would refer to someone who is known to you as a lesbian or gay? Probably not. Okay. It's just that gay is an umbrella term. Okay. So if you hear two women who are a couple and they say we're gay, don't don't be confused. Okay, they're not saying that, like, for example, that we both identify as men and we're two men in a relation. That's not what they're saying. Okay, they're just saying they're using gay as the umbrella term, but they use lesbian interchangeably. Okay, so it can be used either way, either lesbian or gay. It's one and the same. Okay, so then let's look at the word gay. So gay are men who are attracted to other men. Okay. However, like I said, just like queer, gay is an umbrella term, okay, that refers to the queer community as a whole. Okay, so someone may just say I'm gay, but not actually be a man who's attracted to another man. They could be within this umbrella. Bisexual is a person who experiences attraction to some men and some women. I will tell you this is a term that is rapidly changing, especially with persons who I would say persons who are under the age of 30. More often now, instead of using the term bisexual, they will use the term pansexual. Okay, because basically pansexual affirms that gender is a spectrum and not limited to two options or being binary. Okay, now again, this goes back to the piece that I was just saying a minute. This does not mean that there are hundreds or thousands of genders. Okay, it goes back to that piece that people don't see themselves as 100% masculine or 100% feminine. Okay, they use the term pansexual simply because they're saying, I love people no matter what their specific assigned sex is or what their specific gender identity is. They can be a mix of people who identify as partly masculine and partly feminine. So then let's look at transgender. So this in itself is an umbrella term for anyone whose sex assigned at birth and gender identity do not correspond. Okay, so they are the opposite of cisgender. Okay, so trans people, though, transgender is not a sexuality. Okay, so trans people can be straight, they can be gay, they can be bisexual, queer, or any other sexual orientation. Okay, remembering that this is a gender label, not a sexual label. Okay, um, often they have chosen new names. Sometimes they have had them legally changed, sometimes they have not. What they refer to their birth name as that they no longer use is a dead name, okay, because they no longer go by that name, okay? Um, and so we're going to talk about this here in just a little bit in terms of documentation for us, because obviously that is an important piece for what we do. Let's say for the moment that you have an individual who tells you, that I prefer that you call me by this name. Okay, we're going to call people in the back of an ambulance whatever their name is. The documentation piece is going to be a little bit different, and we'll get into that, like I said, here in a minute. Um, no matter who people are, we're going to give them the respect that we want to give all of our patients in the back of an ambulance. So if they would prefer us to call them a different name, then that's what we're going to call them to make this a more comfortable space for them. A lot of times you will hear people when someone purposely calls someone by their dead name. Okay, they purposely have been told I prefer you call me this, but yet they still call them by their dead name. That's called dead naming someone. So you'll hear someone be very agitated, like a trans person be very agitated and say, like, this person continues to dead name me. It's very disrespectful. So intersex. Intersex is a term that I bet you actually know, but you don't know that you know. Okay, because you probably have heard this term as like hermaphrodite or something similar in the past. So this term refers to people who have naturally have biological traits which do not match what is typically identified as male or female. So if you remember back to biology, generally you are either born with an XX chromosome, meaning that your sex is female, or you are born with an XY chromosome, meaning that your sex is male. Some people naturally are born with XXY chromosomes. Okay, so there's been some type of biological mix-up that has occurred, and so as a result, they have very ambiguous genitalia, or they may have genitalia that presents one way on the outside, but internally their sexual organs are or hormones are different. Okay, a lot of times people don't even realize this until it kind of comes up during puberty, when their hormones start to be being produced and released into the body, and they start to feel differently than the way that they are, or they start to develop opposite to the sex that they think they are, etc. So being intersex is not linked to a sexual orientation or a gender identity. Okay, These people can have different sexual orientations and gender identities and expressions. Intersex is just a biological abnormality that occurs. Asexual is an umbrella term used for individuals who do not experience or experience a low level of sexual desire. Okay. Um, it could be someone, generally, someone identifies as asexual. It's not that they are not interested in romantic relationships. They are interested in romantic relationships. They are just not interested in sexual activity. They make up less than 1% of the population. Okay. You also have people who are considered aromantic. So these are people who are not interested in romantic relationships, but are interested in sexual activity. The slang term for this would be like someone who's just interested in like a hookup, okay, but they're not interested in, an actual relationship. You may also hear asexual persons referred to as ace. That's a slang term. It's not derogatory, and so that's what they're saying. If they say I'm ace, it means that they are asexual. So what about drag queens? Okay, because people get confused on this. Um, First off, drag queens are not transgender. Can they be? Yes. Okay. But they are not transgender. Okay. So drag is a performance art where men and women, or excuse me, where men dress as women and perform. Okay. Now, drag is something that it used to be even 20 years ago. Predominantly, the people that attended drag shows were gay men. Okay. However, that has changed in the last, especially 10 years, with RuPaul Charles, who you see there on the top of your screen, who's probably the most famous drag queen in the United States and now in the world. Um, RuPaul has a drag show, RuPaul's Drag Race, that has become very popular in the United States and around the world. Most young kids, teenagers, etc., know about this. It's huge in their streaming apps. It's huge in their television, etc. And so, drag now, if you go to drag shows, they are huge. They're all over the place. And generally, there are sometimes even more people who identify straight at these shows than people who identify as LGBT. So it is predominantly performed by gay men, okay? But it can be performed by straight men or transgender persons. Sometimes you have lesbian women who perform drag and they perform as men. They are called drag queen, or excuse me, drag kings. And then sometimes you have transgender persons who will perform as persons that don't have a strong gender identity, and they are called drag things. Okay. But the biggest performance group is definitely drag queens, who are predominantly gay men. The reason we say they are not transgender is because these men do not identify as trans and do not um, keep their drag persona 100% of the time. They dress in drag for their performances. They do not dress as a woman throughout the rest of their lives. In fact, whatever their drag name is, they would only use their drag name during the drag performance. When they're out walking the street and they are not in drag, they would use whatever their actual given name is. Okay. So the other piece that I like to bring up here is my all-time favorite show, which is MASH. Okay, and hopefully you know what this is. If not, you've got to watch it. You can see it on, I believe, Hulu is what it's on now. So in MASH, there's this character, Corporal Klinger. Okay, Klinger was not a drag queen. Klinger was not transgender. Okay, at no point during the show did Klinger say that he felt like he was a woman or that he wanted to be a woman or anything like that. If you remember back to the show, the reason why Klinger dressed in dresses, as you're seeing there on the bottom of the screen, was simply because he wanted out of the Korean War and he wanted Colonel Blake and Colonel Potter to send him home. He wanted a Section 8, okay, which basically said he was insane, okay? And so he dressed in women's dresses for the entirety of the war, which for MASH lasted 11 years, but the actual Korean War only lasted 3. And he wanted to get out of the army. It never worked for him. Okay, someone like Klinger would have been described as a transvestite. Okay, more so today we don't really use that term. We use the term crossdresser. Generally, this applies to a person who is a heterosexual male, so a straight man who wears women's clothing. Okay, that would be considered a cross-dresser. These are straight men. Okay, so they don't identify as gay, they don't identify as trans, and they are not doing it for like a performance, so drag. Okay. Okay, so now that you understand the terms, let's dive into the healthcare piece to this. There are a lot of barriers to healthcare access, albeit it's getting better with the LGBT community. One of the biggest problems is medical decision making, and this is especially true with older LGBT folks because they um, became adults during a time period when marriage was not legalized. Because remember, marriage is only a recent for LGBT people was only recently legalized. It was legalized by the Supreme Court in 2014. The state of Maryland um, legalized it in 2008. So many people, either older people, never got officially married, okay, because it was not legal. In addition, okay, most of those folks don't have children, again, because it was not legal. That is the complete opposite from today. A lot of LGBT folks who are in long-term committed relationships will legally marry, and many of them, 20% in the state of Maryland, will have children. Okay, so older people who are LGBT often don't have someone who is legally recognized as their partner to make decision making unless they have gone into some type of legal agreement, or they don't have children to serve as healthcare advocates. That's something that's changing because it's very different with the younger LGBT generation. Another issue with LGBT folks, especially younger ones, they are scared of disclosing their identity, so they won't speak to their doctor about safe sexual health practices or medication to help prevent things like HIV, etc. Simply because they're worried that if they tell that to their doctor, the doctor will then tell that to the parent, or it will get out, and they're still closeted, and thus they're scared of that. Okay, they fear discrimination in the medical community, and then also a huge piece of this is just clinicians that are not knowledgeable about LGBT health disparities or LGBT health resources. So as a gay man myself who lives in rural Maryland, I can tell you I've run into this myself. Whereas going to my doctor and my doctor not being aware of some of the specific healthcare needs for our community, especially with medications, and you're going to understand that here in a minute as we get into that, or they just are not culturally aware of terms and things like that. That's exactly why this presentation is occurring in this lecture, so that you can become more aware and try to make it a safer space for the LGBT folks that we encounter in our emergency calls. So in Maryland, there are literally only two primary care providers that are specific to LGBT healthcare. It doesn't mean that you have to be LGBT to go to these. You certainly do not, especially with Chase Brexton. But these are going to be clinicians who are specifically knowledgeable not only about LGBT healthcare issues and some of the medications, procedures, things like that, that are specifically important to this community, as well as sexual health practices, etc. But they are also going to be culturally competent. Okay, so an LGBT person doesn't have to be scared to go to these places and be embarrassed, or have clinicians who they're going to have to explain their sexual habits to, or their terms that they use, etc. These are clinicians who are committed to providing a safe space for these folks, but also um, are knowledgeable about the healthcare needs, etc. So, Johns Hopkins Center for Transgender Health in Baltimore is one of them. The other is the Chase Brexton Healthcare Services. Chase Brexton is the largest, and they have centers in different places. However, you can basically see on the Eastern Shore there's only one in Easton. You really don't have anything in Southern Maryland, and then you definitely don't have anything in Western Maryland. So it's really a resource that's only located in the urban parts of the state of Maryland. With Chase Brexton, it's all-inclusive healthcare. So they have dentistry, they have psychiatry, they have psychology, they have primary care there, dermatology, etc. And so it's kind of like an all-in-one practice for persons. And again, you don't have to be LGBT to go to these places. So let's take a moment to talk about how we communicate with LGBT folks. So I am not saying that you need to ask every patient you have what pronouns you would like them to use. As an LGBT person myself, and as a person who is very active and is constantly on an ambulance practicing as a paramedic, I don't ask this to my patients. Okay, the only time I might ask this is if someone is appears to be transgender. Okay, I might ask them to make them more comfortable. Do you have pronouns that you would prefer that I use? Okay, now, this is another one where there's a lot of urban myths with, okay? 99.9% of the population is going to say, I would prefer you use he, him, she, her, or they, them pronouns with me, okay? I get a lot of questions from people because they're like, how do you use they, them pronouns? And honestly, this is something that is in our minds just kind of like doesn't click because when you were in school you were taught that you referred to boys as he him, or I should say boys, people that appeared outwardly boys as he him, and people that appeared outwardly girls as she her. Okay, and so it sounds weird and it especially looks weird when we write they them. Okay, um, so it is a shift in thinking. Okay, I think the more important piece with this is not that you're necessarily asking your patients what pronouns they prefer, although you certainly could do that. Okay, it's more so is it's the same with like a transgender person and their name. If a patient asks us to use a specific set of pronouns, that you make your best effort to do that. Okay, are you going to mess up if someone asks you to use they them pronouns? Certainly. Okay. Um, but and I think if you truly are trying, and that is evident when you're talking to these people, people are not going to be mad at you. Okay. If they've asked you to use a certain set of pronouns and you're trying, and you're apologetic if you mess it up because you will, it's going to be fine. Okay. I can tell you, I just finished up my doctorate, and part of my research was a survey. Before I could get it approved by my institutional research board, because every study that anyone ever does has to be approved by their college's institutional research board, I was required in that survey to have a question that asked the participants what pronouns they wanted me to use when referring to them, not only in my research, in the writing of the research, but like when I interviewed them, which was the second part. And I'm glad that I did because I had several persons who utilize the term they them. Okay, or persons who outwardly presented as male but utilize the term she her. Okay, and when I went to actually interview them, I needed to know that because I didn't want to um, embarrass them or misgender them with their pronouns. Okay, same piece here is we try to use gender neutral language. So instead of saying, do you have a husband or do you have a wife? And this is something that I do all the time. Do you have a partner? Okay. If people do have a partner, we treat them no different than we would anybody else. Okay. Also, the other piece to understand is that people are in all sorts of different relationships. And this is important for us to know because we often, especially when people are critically ill, are using the partner as the primary person with information or communicating to them, etc. There are people, and this is not just an LGBT thing. This is a straight heterosexual thing as well too, who consider themselves polyamorous. Okay, and this means that they are in relationships where there are more than two people. Okay. Poly being multiple. Okay. Amor is, I think, initially from the Italian, which is love. They are in a relationship that involves more than two people. Okay. We call that today ethical non monogamy relationships. And it just means that they're in a relationship where the people in the relationship, the main two people in the relationship are aware that they are seeing other people, and that it is not hidden. Okay, it is the opposite of someone who is cheating. If someone is cheating, that means that their partner does not know that they are seeing other people, etc. Where someone who's in an ethical, non-monogamy relationships and considers themselves polyamorous is a person who is in a relationship but their partner knows that and is okay with that, and they basically have an agreement on those types of things. So you may encounter patients who are in a polyamorous relationship and have multiple partners that you may have to communicate with, etc., on scene. So now let's talk about the documentation piece, okay? Because I know everybody's favorite thing is documentation, right? So a couple things on eMeds Elite. Okay, number one, it does not use the term sex. It currently uses the term gender, which is the way they use gender here would not meet the NAEMSP definition. But basically, what they are referring to here is actually the patient's sex. So, is this patient physically male or physically female? Okay. So, if you have a transgender patient, okay, someone who appears outwardly transgender. The way that I do the documentation piece with this and what I would recommend to you is first off, when they say, I would prefer that you use these pronouns or I would prefer that you use this name, okay, explain to them that you have no problem doing that you will do that in your communication with them, okay. However, for the medical record, this is a legal document and it has to be whatever legally is your name, okay, because it has to sync with the medical system. So you would ask them legally, have you changed your name to this new name? Or if not, what is your legal name? Because I need to put that into the medical report. I can still call you whatever your preferred name is, okay? But I need to put your legal name here, okay? Same with sex. You would explain to them that it's important for the legal report that we know what your biological sex is, and there are some things like a 12-week, which we'll talk about in a minute, where that does matter. We need to put that on. Can you please tell me if you have a sex assigned of either male or female? Okay. Okay, so now let's look at some of the prevalent medical issues here. So for lesbians, they are at an increased risk of ovarian and cervical cancer, largely due to the fact that they receive fewer PAPs than heterosexual women. And also, they are at an increased risk of breast cancer, largely due to the fact because they have fewer pregnancies, less frequent use of oral contraceptives, and increased alcohol intake. They are also 4 times less likely to get mammograms annually. When we look at prevalent issues for gay men, their incidence of anal cancer is estimated to be 20 times higher in gay men than it is in heterosexual men. It's part of the reason, especially with the younger population. Although the guidance currently from the CDC is you can get the vaccination up until 35, they really push it with teenagers, especially parents getting their children, no matter if they're LGBT or not, the HPV vaccination, but that is especially true for gay men. But unfortunately, many young teenage gay men do not know that, it helps to prevent things like anal cancer, etc. And so they don't get it because they don't have sexual health classes in school that go over often LGBT health. Eating disorders is huge, okay? Gay and bisexual men have the highest prevalence of eating disorders compared to heterosexual men. They also have the highest prevalence of eating disorders of any other group, okay? Even more so than young teenage girls, which make up a large percentage of people with eating disorders. And then HIV is the last big one. According to the CDC, gay men make up 69% of new HIV infections. 26% of them are African American and 22% of them are Hispanic. So why is that? Well, it goes back to the piece that many of the new HIV infections are, especially in the African American and Hispanic community, are from men who are closeted or young men. That goes into the next piece, teenagers, etc., who are closeted and experimenting, or who are closeted and sleeping with male sex workers, and they are not utilizing protection or medication to help prevent that, and so they make up the largest group of new HIV infections. Okay, of course today HIV is no longer a death sentence because of medication development, and also it's not nearly as widespread in the gay community as it once was, simply because of education, contraceptives, and things that have drastically changed since the 1980s and the 1990s. So one of the pieces that maybe you're not familiar with, but you definitely need to be familiar with as a clinician, is the medication PrEP. You will hear your patients just say PrEP, and you'll be like, what the heck medication is that? PrEP just stands for pre-exposure prophylaxis, and there are two versions of it on the market, Descovy and Truvada. Okay. I guarantee you, if you have a friend, family member, etc., who is gay, and you say something about PrEP, they will know exactly what it is. Okay, and I guarantee you, now that you've seen this, if you didn't know about PrEP before today, you're going to see it on billboards all the time. It's one of those things you'll recognize now, because health departments have really pushed this out in the last couple of years. PrEP is relatively new within the last 10 years. Basically, PrEP is a medication, okay, it's a prophylactic medication that is prescribed to people who are at high risk for contracting HIV. If you take PrEP, okay, your risk of contracting HIV goes down by 99%. Okay, so it is darn near the cure, but it is not a cure. Okay, for HIV. What the medical community says is if you are taking PrEP and also utilizing condoms, your chance of contracting HIV from another person is almost negligible. Okay, it's very, very, very small. Okay. In terms of getting PrEP, you can go to your doctor, you can go to your health department, et cetera. However, this again goes back to having doctors who are knowledgeable. Um, and the deal is, if you're prescribed PrEP, you have to be tested for HIV and STIs every 3 months in order to get your next prescription. It is predominantly prescribed to men who have sex with men because they are the highest risk group of contracting HIV, but it is also prescribed to women who have a partner that has high risk behavior, or women who are sex workers and often are having unprotected sex. And it is also prescribed to persons who inject drugs, okay, illegal drugs, especially needle sharing, things like that. When I give this presentation, I often have people ask me, well, can a straight person get PrEP? Certainly you can, but it's just like any other medication. It is long-term going to be hard on your liver. And so you don't want to just take medication to take medication. And it's really why they push it just for the groups that are going to be the highest risk for contracting HIV. So PrEP, Descovy, Truvada, that's what we're talking about. So a couple quick myths about HIV and AIDS. How are persons infected? Now, this is something that has drastically changed since the 80s and 90s because, of course, those of you that were alive in the 80s and 90s will remember there was so much unknown and so many urban myths that were out there. People thought if they touched someone, especially someone who was gay, they could get it. If they were in the same room, etc., they could get it. We have a much better understanding of HIV/AIDS today. 85% of new infections are a result of sexual intercourse and exchange of bodily fluids. Okay. 10% come from IV drug use and 5% come from blood. Our chance of contracting HIV from blood in an ambulance, okay, is very, very, very small. Now, I'm not saying that we should not wear PPE gloves. Absolutely not. We should still always wear our PPE gloves because we want to be the most protected that we can. But if someone tells you they're HIV, you don't need to freak out about that. Okay. One of the other pieces to understand is you may have a patient who will tell you, I'm HIV, but I'm undetectable. Okay. Basically, this means that a healthcare professional has confirmed via blood test that that patient has an undetectable viral load. Okay. Meaning that the amount of virus in their body is so minuscule that they actually cannot transmit that virus. Okay. And folks who have HIV/AIDS get viral loads checked very frequently. In addition, there's a lot of urban myth about this as well too. If someone has HIV but they're undetectable, they can't transmit it to someone. So they can have unprotected sex without transmitting that to someone who does not have HIV. Is it recommended? Absolutely not. People should be, especially HIV patients, should be utilizing things like condoms, etc. But if they are undetectable, they cannot transmit it to someone else. So, prevalent issues for the transgender community. Um, they have a high prevalence of HIV/STIs, largely because many of them, especially when they first come out as trans, are living on the streets. They've been kicked out of their homes, etc., and they turn to sex work. Okay, they are a huge portion of victimization and hate crimes, especially. We'll get to that here in just a minute. They have a large amount of mental health issues and suicide. And then specifically when we look at those who are transitioning from female to male, even if they've had their breasts removed, that risk for breast cancer still remains, okay, or they've had breast reduction, okay. Um, 50% of transgender have experienced discrimination or victimization in schools, okay, or violence, okay. 63% have suffered physical or sexual abuse at schools. 69% have experienced homelessness, and 57% have families that don't speak to them. So some other pieces, and we're just going to briefly go over this because your piece that you will do on the MIMS website that's required for your MIMS side of the refresher goes into this a little bit more in depth. You may see a transgender person who is utilizing a binder. So let's say that you have a patient that you are removing clothing on, a trauma patient, etc. You may see that under their shirt they are wearing a binder. Okay, basically this is used by transgender men. So that would be someone who is born with the sex assigned of female, but is identifies their gender as a male. That's a transgender man. Um, they wear these to basically have a flatter chest, okay, and not look make it basically look more masculine, okay. So some of them use binders simply by shirt lane. Some will actually buy commercial binder or compression top like you're seeing here in this picture. Some will use sports tops or bras, and then others will use kinetic tape designed for skin adhesion and tissue support. There are a couple important things to understand about binders, okay? And again, this is why it's so important that these individuals have healthcare clinicians who are knowledgeable about these things, because if they are considering using a binder, they really should have that conversation with their doctor. Because they shouldn't be wearing them more than 8 hours a day. There are medical risks associated with it. B, the sizing is very, very, very important. Because you can cause some serious medical conditions if it's not sized correctly. So it's especially important with like young people that they actually have the conversation and make sure that the product they're using is correct. When we look at common risk associated with them, general aches and pains, it can actually alter the rib cage if they're wearing them for more than 8 hours a day or they're not wearing the correct size. Breathing restriction, overheating, circulation compromise, nerve compression, bruising and scarring, itching and other skin irritation, all of those things are considered. It's very similar to the very tight corsets that the Victorians wore in the 1800s. On our end, we don't want to remove them unless it's absolutely necessary. Okay, that is not because a lot of people think we say that because, oh, is it like a compartment syndrome thing or something? Like no, 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 it's not that. Okay, it's more because of the a mental and emotional traumatizing effect that can have. Okay, on a patient. So I'm not saying that if a patient has one of these and we're looking for trauma, etc., that we don't remove it. Nope. If you have to remove it, you have to remove it. Okay. At the end of the day, we have a job to do, and if a patient's been involved in some type of serious trauma, we need to be able to actually physically assess and see any injuries that they have, which would mean that we would need to identify, or excuse me, to remove the binder. The biggest piece that you need to remember when you do that is if you have a patient that's conscious, you need to explain what you're doing and why you are doing it and try to make them as comfortable as possible. Okay. And maybe they are actually even able to remove it themselves. Okay. If the C spine's not involved or anything like that. Okay. If they're unconscious, I cannot emphasize this enough. And this goes back to the piece that the story that we started with. Um, Remember that so often when people are unconscious or in comas, etc., and they wake up, they will tell you that they heard the conversations that were occurring when they were unconscious, and we thought that they didn't actually hear us. Okay, so please, please, please be very careful what you say around people who you think are unconscious and can't hear anything that you say. Okay, we want to give the utmost level of respect and understanding to anyone, no matter their level of consciousness. The other piece that goes with this is tucking. Okay, this is where a transgender female, okay, someone who was born as the assigned sex of male at birth and identifies their gender identity as a female, they will use they can use a commercial device like the ones that you see here in the picture. And basically, it is to cause their genitalia to look flat, to basically look more physically female from the outside. And basically, what happens is that they push the testes upward into the inguinal canal, and they position the penis and scrotum between the legs towards the anus. Okay, they then use these commercial devices to hold that in place. But I can also what you need to understand is that not all will use a commercial tape like this. Some will just use a tight underwear. Some will even use things like duct tape, etc., to do this. Drag queens, for example, do this as a part of their transformation into a woman for their performance. So you could see something like this again if you're doing a trauma assessment. So let's talk about 12 leads with transgender patients. Okay, so one of the things that I do in my own practice is 12 leads are pretty invasive in terms of a patient's privacy. So no matter if my patient's straight, gay, transgender, bi, whatever, I always explain what I'm going to do because I'm about to get into someone's personal space. Okay, so I always explain to patients something like this. I need to take a look at your heart to determine if you're having one type of heart attack that we can detect in the field. Okay, because we can detect this, then we can begin treatment and then make sure that you get very quick treatment to save your life at the hospital. So in order to do that, I need to take a 3D picture of your heart. Okay, so I'm going to stick a bunch of sticker electrodes on your chest and on the side. Okay, and I'm going to take a picture of your heart that way. Okay, so I'm going to be in your space, but this is why I'm doing that. Okay. Now, if I have a patient who is, I think, might be transgender based on their outward appearance, I would say to them, the heart, especially with the positioning of the heart, is a little bit different between people who are biologically female and biologically male. Okay. So when we do this 3D picture of your heart, I actually need to tell the computer whether you're biologically female or biologically male so that I can make sure that the machine is analyzing your anatomy correctly. Okay. Can you tell me if your sex at birth was male or female? Okay, that's how I would approach that. Okay, so it is important to do that. Now, let's say that you have a person who is unconscious or you can't tell, then you're just going to take your best guess. Okay, but otherwise, it's a delicate question that we just ask respectfully and put it in whatever their sex assigned at birth. That's what goes in. So mental health concerns, I already talked about the fact that homosexuality is no longer a mental illness. It was removed in 1973. Okay. LGBT folks have a higher prevalence of mental disorders than heterosexual persons. The biggest group of them being anxiety and depressions, and they have almost double the amount of the following versus straight persons. So mood and anxiety disorders, depression, and then suicidal ideation attempts. Okay. Um, so in 2019, UCLA did a national survey of transgender adults, and they found that 30% had been physically attacked in public in the last year. 98% had considered suicide in the last year, so considered it. 51% had actually attempted suicide. The largest group of suicides in the United States are transgender persons. And it is a number that unfortunately is not decreasing. Homelessness, 40% of the youth in homeless shelters in the United States identify as LGBT. When they look at the most frequently cited factors for why they are there are three that are the most frequent to come up. Family rejection based on their sexual orientation or gender identity, being forced out by their parents after coming out, and being sent to conversion therapy, okay, which is a therapy that has been proven in medical science to be a pseudotherapy, basically where you are sent to be forced to being straight. Many states are in the process of making that illegal. Maryland just made it a conversion therapy illegal in the last couple years. This map shows you the states that are dark green are states where it is currently illegal. States where you have the green stripes are states where there are partial bans in place. The orange states are states where there are currently legal challenges that are ongoing, and then your tan states are states where there is not currently a policy. However, I will tell you that it seems like every year more and more states are banning this so-called therapy. Hate crimes, of the 7,759 hate crime incidents reported in 2020, more than 1,393 or nearly 20% stemmed from anti-LGBTQ bias, and that comes from the FBI's hate crime database. Annually, the FBI is seeing a 15 to 20% increase in these types of hate crimes. Of the nearly 1,200 incidents targeting people due to their sexual orientation, the largest portion of them were individuals who were transgender. Substance abuse is also huge. The LGBT community has the highest rates of tobacco, alcohol, and drug use. Okay, largely due to the fact that they are escaping social stress, and with young people, when they are first coming out, or they haven't come out their closet, but they're going to try to meet their people, they migrate to LGBT clubs where things like recreational drugs, alcohol, and cigarettes are all huge. So they have a large percentage of them that are using those products. So finally, how do we create a positive space? Okay, we're going to treat spouses and partners of patients the same as we would any other spouse. You can join the International EMS and Firefighter Pride Alliance on social media. It's free, and get good information from that. Many agencies now have an LGBT plus liaison. Okay, the one that's closest to us is the District of Columbia. Washington D.C. Fire Department has an LGBT liaison. It is not that these persons do anything specific with LGBT patient care. Generally, these liaisons do a couple things. Number one, they do trainings like this for people in the department to ensure that the clinicians are aware of cultural terminology and healthcare needs, just like you just went through. Additionally, they often work close with health department to do education on things like PrEP, on things like condom usage, safe sexual practices, like for lesbian women, encouraging them to get mammograms, things like that. That's what those persons do. Okay. Many agencies will acknowledge days of observance like World AIDS Day and National Transgender Day of Remembrance, and celebrate things like Pride Month in June. You'll see there on the side of the screen, New Orleans EMS, their EMS badge can change throughout the year, and their clinicians actually have the option during Pride Month in June to change out their badge to this, and it's an option. And like I said, there are different badges for different months for different things that in New Orleans they actually change them out for clinicians who would like to change them out. So I hope that you got